Hi guys, welcome back to my YouTube channel. My name is Jemima. Sorry, my vibe will be quite low in this video because I have been sick. I've not been feeling too well and I've not been able to shoot any video for a long time, and I'm like, I need to get this video done. If not, I would have problems shooting. I'll be uploading video and I don't want to miss any of my upload schedule. So for the background, I'm in church. I'm in church and I'm actually waiting for something, and I was like, let me just get this video done at once now that I have the opportunity to. So I'm going to discuss my biochemistry practical exam, my biochemistry practical questions, and I have the question paper right here with me. This is it. It was not an easy exam at all. Like we have the front, we have the back, and it still have like it's still extended down there. So biochemistry practical exam was really thorough, and each of these practicals we carried out ourselves. Like each student had his own reagent, each student had his own samples, his own everything. So there was no excuse for you to talk to anybody. So I'll discuss these questions with you and let you know how I did mine. So okay, keep watching. So the first question said, studies have revealed that eating standard saturated fat can raise blood cholesterol. Elevated serum total cholesterol is a modifiable risk factor for heart disease in adults. Likewise, strenuous duties which can require prolonged periods of near maximal heart rate and high workloads could mark future cardiovascular disease risk. So the serum samples of the following patients, they actually gave us two serum samples. Okay, first one, Mr. Jenkins, a fire factors, 45 years, has low cardiorespiratory fitness. And for the second sample, it was of Mrs. Afia, a sedentary civil servant, 50 years, obese, were collected for estimation of their total serum cholesterol levels enzymatically as represented in the table below. So they actually have a table that we're expected to replicate on our question, on our answer sheet, showing distilled water standard sample reagent and its absorbance at 500 Newton meter. So it just depends on whatever is in that sample. If it's the distilled water, you put it. If it's the standard sample, you put it, and then you put in the reagent. And of course there are two tables, so we're expected to do for both the sample A, that's the Mr. Jenkins sample, and the sample B, that's the Mrs. Afia sample. So the questions, they said, write a comprehensive laboratory report on how the above tests will be carried out in a medical biochemistry laboratory and state your procedure in words. This is very straightforward, but however, for you to write a comprehensive laboratory report, you have to start with the date of the experiment. And as you're writing this, remember that you have two samples that you're working on. So your procedure, you have to include that you put into both sample A and B. You can actually name them sample A and B, but what I did is anytime I write sample A, I put in brackets Mr. Jenkins sample, because these people marking your scripts may lose sight of the fact that you decided to use sample A and B, and they may circle it and be like, what is this person talking about? So at every point that I put sample A, I still put in bracket Mr. Jenkins sample, and every point I put sample B, I still put in bracket Mrs. Afia's sample. So you can never be too careful for your main MB exam. So like I was saying, you start from your date of experiment, your title, your aim, your sample, your reagent, your equipment. If there's an apparatus like this, in this situation you have an apparatus which is the UV spectrophotometer, so you put it there as well. And then your the principle of the experiment, you should know it and you should have memorized it before now. Actually, you put this principle, you put the procedure, you put your observation, you put your result, you put your conclusion, you put your biomedical importance. So then after they said this, state your procedure in words, so you have to include that. And so two said estimates the total serum cholesterol levels of samples of Mr. Jenkins and Mrs. Afia respectively in millimole per liter and milligram per dl. So this, what you're trying to tell you is that whatever you're telling them in millimole per liter, you still have to convert it to milligrams per dl. And remember the formula for getting out the total cholesterol level. So don't forget the formula. Make sure you have these formulas at your fingertips. Then they now ask, what is your inference about the sample's results, and what are your recommendations to the individuals based on their results? So they actually gave us a table, a reference range of total serum cholesterol. So I would strongly suggest that you use this reference table to get your inference. So if their total serum cholesterol level is below 200 milligrams per dl, it's desirable. So you'd know what to say to them as a medical doctor. You'd know what you say to them. If it's high, you say that. If it's borderline high, you look for the right words to put. Then the 4 IV question says, is there any correlation between the sample results and cardiovascular disease? Of course, there's a correlation. So you have to indicate how this result affects their risk for having CVD. So if it's high, the relationship between cholesterol level and cardiovascular diseases. Then what is the medical importance of this test? Like I said, you have to include that of what use is this test to medicine. Then IB said, state the principle of dipstick test for protein. This is actually very straightforward. I've mentioned already in my biochemistry. Please, if you've not seen my video on how to prepare for and answer biochemistry practical exams, I'll put the link up here. I've already mentioned that your principles should be at your fingertips. IC said, 1C said, define specificity and sensitivity of a screening test. So this one too is quite straightforward. You should define both of them. They didn't ask you to compare or contrast. Just put in heading sensitivity, you define what it is. Put in another heading specificity, define what it is. 2 said, you have been provided with 2 different urine samples, labeled M and N, and a standard labeled S. Using the reagents provided and following the procedure below, determine which of the 2 samples is pathologic. State the biomedical importance of this test. So this one too, you have to report them in a standard laboratory practical, like I have listed, from the dates of the experiment down to the biomedical importance of the experiment. So they actually gave us a procedure. Arrange the 4 test tubes and label them accordingly. Add 1 ml of urine sample M and N to their respective tubes, and distilled water to tube B and standard to tube S. To each of the 4 tubes, add 1 ml of 3% TCA, respectively. Shake the tubes gently and observe for WDT. Then record your result as negative or positive. So for this one, they've already given you the procedure. You carry out the experiment as listed here and record your results. Remember the standard way you should report your practicals. Straightforward, nothing so difficult here. And remember your principles. So that's why I said principles of any experiments that you're carrying out is very, very important. You should know it. And 3A said, a biological material was collected at a crime scene and smeared on a test paper for typing by a trainee forensic scientist interning at the MBC lab. He has, however, stacked the test paper with other test papers without labeling it, and the oversight was identified by his lab manager, but it has become daunting to identify the right paper which has the smear. You are required to help to identify which paper has the biological smear and spots using the reagents provided. So you have to state why the spots gave a positive test to the reagent and what the biomedical importance of the test is. So you already know what your title is, spots test for protein. You need to know the reagents provided in hydrin. You get, so you need to know the practical, so that when you're provided with the reagents, you know what practical is expected of you to carry out and what principle you're going to go by. Like this 3B said, state why the spot gave a positive result to the reagent. They're asking you for the principle. What is the principle that is governing that practical? And like I said, you start with your date of experiment. This one is just a spot, but after putting the reagent on the 4 different spots that you're giving, give it time for it to react. So that's my own advice. And they usually use pens to write A, B, C, D for the different spots. I advise that you just put a drop of the paper of the reagent and give it time. I remember in my time I kept putting and my result was not as neat as it was supposed to be. So don't be like me. But just make sure that every other thing you write off, from your date of experiment to the aim, the everything, just make sure that they are all well represented. Okay, thank you so much for following up with this series. I've actually answered my anatomy questions, my physiology questions, my biochemistry theory questions. I've talked about my viva questions, both general viva and distinction viva. So if you've not seen any of those videos, please go and see them. I have so much passion for what I'm doing, and I really wish that you all would have the 60s and the 70s that you want to have. So with this said, I remain your girl Jemima. Bye.